Alright, let's look at the question, how can I save money on healthcare costs? As part of our Walk Like an Investor series. Of course, discussion of any CUSIP or security is for discussion purposes only. Do not buy any security mentioned in this playlist unless you perform your due diligence. Note that I purchased shares of Lehman Brothers 3 days before it collapsed, so anyone following me into a trade is taking excessive risk and may lose significant financial value. In addition, at the time of this video, I may or may not own shares of the company mentioned and may or may not have kept those shares, depending on what circumstances changed. So one discussion recently I had with friends is healthcare costs have obviously been growing, and I think most people in America would agree with me on that. I know that back in, I think it was around 2000 or 2002, maybe it was 2003, but I think it was 2000, maybe 2001, I was paying $60 a month for a high deductible plan, and the deductible was $1,000. That was a really good plan. Well, nowadays most of the deductibles are $6,000, and the plans usually cost anywhere from $250 to $400. I mean, they're ridiculous in terms of cost. So it's grown a lot, okay? And one of the things that they brought up, and we're going to look at these two zoomed in graphs, are that there are a couple of funds that have done very well against the S&P 500 that deal with healthcare. And let's see, the first one is a Vanguard Health Fund, okay, which is VHT, and you'll notice that it starts in 2004. This is the beginning date, at least that I could track, and you'll notice that over the course of time, it's outperformed the S&P 500. It's at 160% in the course of its life, or the total return that is, whereas the S&P 500 is only at 83%. And there's one here by the Spider Fund, which is XLV, and it is 174%, and the S&P 500 over the life has only been 79%. Now this one starts, it looks like in 1999 from the graph. All right. Now I should also point out that I believe this one has a 0.12% expense ratio, the Vanguard one, and the Spider has a 0.15% expense ratio. All right. So one of the questions I have here is, going back to this, in terms of how can I save money or maintain the pace of healthcare costs, is would it be good, or let's not use the word good, that's a bad word. Let's use the word, would it be prudent financially to invest in a healthcare fund? These are both ETFs, so they own healthcare stocks. You don't want to directly invest in those. That would be more risky. These are just funds overall, to hedge against healthcare inflation. Okay? If you look at it, it's like, well, they've beat the S&P 500, but would it be smart to invest in these to hedge against healthcare inflation? So I decided to dig into the numbers and just see what would make sense. So according to the Center for American Progress, I'm going to warn you, this is a liberal publication. And the reason why I have to warn you is because I'm an apolitical person, as I made clear on my YouTube channel here. And I don't want people to sit there and say, well, you're quoting a liberal publication, therefore, you see, you're liberal. No, 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 no. No, no. I'm quoting them because they actually had numbers. The conservative ones, which I found, agreed that healthcare costs had risen, but I couldn't find whatever numbers they had. But what was it rising by? I understand that Americans like to complain about, well, it's going up. Okay, but how much is it going up by? We need some numbers, otherwise we can't fix a problem. Right? You got to get the numbers. Okay, and they said that it is doubled at a rate of, that it's doubled inflation, and that healthcare is rising at a pace of 5.5% a year since 1994. Unfortunately, neither of these funds go back to 1994, but we can look at starting in 2000. Okay, my high deductible plan, like I said, 60 a month, $1,000 deductible. Cool. Using the inflation numbers for CAP, the same plan should cost me $135.44 in 2015, which would be a 125.73% increase in price. Now, if we go back, we'll see that XLV is 174.63%. Interesting. So it actually has, what this means is there's been some real gains, not just nominal gains here. Technically, even if you subtract the 0.15% cost. So there's been some real gains in XLV versus the healthcare cost. Again, if Center for American Progress is correct and they've grown at 5.5%. Okay? So this does not mean you should go out and buy XLV or VHT, right? And by the way, VHT has as well because it's 160%. The problem though is this doesn't go back to 2000. It starts 2004. And if you look at 2004 here, you'll notice that this fund had already gained. It looks like XLV, this one here, hasn't lost to the S&P 500. Granted, this isn't a perfect graph, but it hasn't actually lost to the S&P 500 since 2001. And even then, it doesn't look like it was below it. Well, no, this is the point that it was below. Okay. No, I take that back. No, okay, so 2000 maybe was the... No, 2001 right here would have. Okay. So, it's done pretty well, but either of these funds, it looks like keep the pace with healthcare costs. Okay? Now, or I should say actually beat healthcare costs slightly. So, for a family, let's say that you think or you plan in your budget that you spend about $5,000 for each individual on healthcare costs, which I understand that's just killer. This, by the way, is where all that extra money that people are saving in gasoline are going. That's just where it's going. Banks don't realize this. It's just eating people alive. And I totally get it. It's very frustrating. But would it make sense to buy these funds to hedge, right? Obviously, if healthcare costs go down, that would be great. But a lot of us are kind of feeling like that's just not going to happen, right? So would it make sense? It's a good question. You can look at this. I mean, there's going to be risks involved. It could always fall, but if it falls, I guess what you could always track is when it does go down, does that mean healthcare costs for those years went down? I mean, how does that look for consumers? Okay. The real solution to healthcare, and we're talking about the long term, the real solution. There's not going to be a solution really in terms of investing. There's not going to be a solution in terms of government. The real solution comes down to we need healthcare entrepreneurs and healthcare small businesses that solve real problems by making solutions that cost less. That's all there is to it. Here's the 3 reasons why this won't happen. Number 1, we have too much bureaucracy. A person starting up doesn't have the money or time to dig through all the patents and deals with lawyer speak, right? And deal with lawyer speak, I should say. Simply put, it discourages new ideas and solutions, right? I had a friend a couple of years ago, and she had a really great idea that the average American in his or her life probably spends about $5,000 in healthcare costs. Her idea would cost about $150 for a lifetime. That's a lot of money saved. Over $4,800 that all of us would save in our lifetimes. However, when she started digging through all of the patents that she would need, all of the conversations with lawyers, she gave up. Just wasn't worth it. Way too much bureaucracy in healthcare. Way too much. And more government will lead to more bureaucracy, right? This is where you have all the elites, the people who go to Harvard and the Yales. They're all buddies. They create bureaucracy to keep everybody who's not on the inside out. That's the whole point of bureaucracy, right? Favors the people already in the inside. And it discourages new ideas. The problem is you don't get solutions, okay? I say here, point number 2, the reason why you're not going to have healthcare costs lower, you have central bank corruption. What I mean by that, central banks right now keep interest rates low. What this does is if interest rates are low, people will put money into the easiest place to generate a return, usually real estate, right? You can go borrow money really cheap and just dump money into where you can get a return at. Where do people generally get a return? Duh, real estate, right? What would happen if I said, as a central bank, I'm like, okay, from now on there's going to be different interest rates for different industries. And I am going to charge a 10% interest rate to people who, let's suppose, want to take the money and go invest in real estate. So investors now, their margin accounts, anytime they invest, they take margin and they invest in, let's say, a healthcare industry, they have a 0.5% interest rate, very low interest rate. But if they invest in a real estate industry, like an real estate stock or ETF or whatever it is, their margin account's charging them 8%. What ends up happening? It starts to encourage more money to go into places that develop solutions, right? But see, the central bank is just leaving interest rates low, right? And that affects every industry, even though we may not want money to go into certain industries. In other words, there may already be a bubble in those industries. This is part of the reason why you see like tech bubbles and housing bubbles and all this. What the central bank is doing is by keeping interest rates low, it negatively impacts all kinds. You get malinvestment in industries that there shouldn't be, right? That's all there is to it. The central bank is not helping this out. And then finally, I say here, what you need more of is results-based education. You can see Jack Andraka, I probably butchered his name, but his solution to detecting pancreatic cancers, young individual, basically he looked for solutions and he got solutions. The bottom line is you don't have results-based education, right? In fact, he even admits that when he was in high school, he wasn't paying attention to what he should have been learning and he was figuring out how to do something. That's because our whole education system is backwards. You don't learn for the sake of learning. You learn for the sake of getting results. And if you're not getting results, then whatever you're learning is useless. The end. Okay? These three are the reasons why you're not getting solutions in healthcare. Okay? So, if you're not contacting your representative, your senators, etc., and talking to them about these three things, get in control of the central banks, start holding them accountable, too much bureaucracy, start eliminating the bureaucracy, and results-based education, quite frankly, you're not going to get solutions. 20 years from now, healthcare may cost $50,000 for a high-deductible plan. They just may. That may be the future. And these are the only three in the long-term solutions. And it's not about political parties. Doesn't matter about any of that. Doesn't matter. These are the real solutions here.